has been on a 2-day bender with ice and GHB.
I'm gonna need to wake up, mate.
Alright, mate. Alright, restrain, please. Just need to physically restrain him. Holy hell. So just to clarify, then when you found him, just tell me what he was doing.
He was just really agitated.
And it's GHB and ice.
Ice. Over 2 days.
A young man has been brought in under heavy sedation by paramedics after finding him behaving violently at his home.
Oh, mate, you're a mess.
Dr. Meyer holds the young man's head on an angle to help him breathe better, while she decides if she should wake him or not.
I'm thinking we should wait it out.
So a partner came on scene because he's been on a 2-day sort of bender with ice and GHB. He's been throwing things around.
Yeah.
There was no big things displaced. It was more just chairs and stuff that had been thrown.
Ice is a drug that people are using to gather that high or elevated perception of the world. So people will use drugs like GHB, which is a more sedative drug, to help them go from that very high to that very low. All I see is the very, very serious side effects of what happens when these drugs are used. They're often life-threatening.
Lots of track punch. Are there?
Yes.
The man is unconscious, a combination of the drugs he's taken and the sedation paramedics gave him to bring him down from his 2-day bender.
How you doing, my friend? That's not a good sound, is it?
He's struggling to get enough oxygen, so Dr. Meyer moves him on his side.
He seems to be a bit better on his side because the soft tissues of his airway aren't collapsing back.
When we're looking at somebody who is suffering from an overdose like this, their reflexes in their airway are so depressed that we have to make an educated and expert decision on when is the right time to intervene.
I'm gonna need to wake up, mate.
The worry for Dr. Meyer and Nurse Ebony is how he'll wake up. There's every chance he'll be as angry as he was before paramedics sedated him.
He sounded like he was in a pretty aggressive state. They needed to gain control.
Nurse Ebony, a former vet nurse, retrained to take on the demands of critical care nursing.
I really do enjoy the challenge of having to think on your toes and having to prepare yourself for the very worst that could potentially happen. There's a form of painful stimuli which is called the sternal rub, and he responded to that, and very quickly.
Open your eyes. Open your eyes.
Ebony tries to wake the man to help him breathe better on his own.
I need to get some goggles on. This patient had absolutely no idea what he was doing, where he was. He was in a completely different world.
The volatile young man stirs.
Open your mouth. You all right? Hey. Calm it down.
We are trained on what to do, but even still, we can sometimes be put in situations that make us feel quite concerned, quite uneasy.
Yeah, maybe step away. I don't want you to get hurt.
There's no certainty what the ice-affected man will do next.
Because you landed on it awkwardly, I think, with all your weight.
Over in the ambulance bay, paramedics have arrived with electrician Sean, who suffered a catastrophic foot injury after falling 4.5 metres from a ladder.
So the deformity you're seeing is the base of the tibia, which is sticking out through the side of the foot, essentially, at the ankle. So he'll need some procedural sedation to straighten that out and a wash.
51-year-old Sean was trimming a tree with a chainsaw when he was hit by a branch and fell, landing on his ankle. Emergency Dr. Luke Delarue is juggling several patients when the injured Sparky arrives.
Yeah, so it's an open fracture dislocation of the ankle, so the tibia is pushed through the skin on the inside of the ankle here. So what you're seeing is the ankle is turned sideways, and the bone here is actually protruding out by probably 2 inches or so it's actually pushed through the skin.
So if you land with the ankle turned out a little bit, that force is transmitted through the inside of the joint and it can just pop open, unfortunately.
1, 2, 3. Oh, 1, 2, 3.
Please. My ankle, man, please.
I know.
With his tibia or shin bone broken and sticking out through the skin, Sean's pain level is through the roof.
You're killing me. Whoever's on that is just killing me.
I know.
What was it? Is it this guy?
Foot down.
Whoa, stop squeezing my ankle.
Dr. Luke steps in. He needs Sean to cooperate.
We're gonna get you across, get you some pain relief and get you comfortable, okay? Just relax. Once we get you, put your arms down.
The inhaler Sean is sucking on is for pain relief, but the so-called green whistle is barely helping to relieve his agony.
I need something because whoever's holding my ankle...
We need you on the bed to treat you, so big breath.
Put it in your mouth. Over on 3, guys. 1, 2, 3. I know it's not nice.
The seriousness of the injury could put the electrician out of work for a long time, or even worse.
A fracture dislocation of the joint certainly can be limb-threatening. If there's a long period of time where there's inadequate blood flow to the foot, then that can potentially result in his foot dying, essentially.
Can you feel me touching at the top?
Don't spit, mate. No spitting.
In the Royal Melbourne Emergency Department, a young man who's taken a cocktail of drugs is in a violent rage. His terrifying behaviour is a risk to Dr. Maya Cubitt and the nurses. He's been on a 2-day bender from a deadly mix of ice and the drug GHB, having trashed his home before being sedated by paramedics.
In the back of my head, I'm thinking, where's the emergency buzzer? Can I reach it?
Don't spit!
Alright, code grey, please.
An emergency alert for security, called a code grey, goes out.
The drugs provide some escalated adrenaline type state that increase your strength. So it is a phenomenon that we see when somebody's agitated, that often their physical strength is difficult for us to manage.
We just need to physically restrain him. He's a spitter, so I'm just going to put a mask on him.
It takes 7 people to hold him down.
All right. Just get 5.
This patient is behaving in a way that is suggesting his brain is disorganised, so we will keep him sedated while his brain comes down off whatever combination of drugs it is that has got him here, but also to keep us safe.
Everybody ready? On 3. 1, 2, 3.
The man is momentarily calm.
You all right?
Okay, ready?
Sometimes, like, things can happen quite suddenly and you do feel quite uneasy.
But we'll physically restrain him, eh? I'd like to shackle him in that position with a pillow under his head, ideally.
In this situation, I was thinking, this is a young guy. He looks like he's fit. You know, he has so much potential, but he's here. There's got to be a lot of really bad things to lead them to that point. I feel compassion for these people.
I don't want anyone to get hurt.
Get off
it! Dr. Maya desperately tries to sedate him.
Stop it. Bloody hell.
Hey! Get off me! Get off me!
Hey, I'm really glad that you can speak to us now.
The man continues to fight in his drug-fueled rage.
Get
off me!
If you stop behaving like a pork chop, we'll let you go. Those are the rules.
Can you get off me, please? Please. Hey!
My name is Maya, I'm the doctor, all right?
Can you get off me, please?
The reason that everybody's holding you down is because we're having trouble keeping you safe, all right?
I need to fix. Ow!
This is an unexciting experience all around. Are we going to lose this cannula, guys?
I promise.
No.
Please.
Bloody hell. I think that cannula's gone, guys. I can't use it. Sorry.
The security guards were able to create a stable place in his foot where I put a cannula in to deliver the medication.
Are you happy for me to just...
Yeah. Massive pupils now. Airway, breathing, restrained, nicely asleep. Let's leave well enough alone. I'm very grateful that you're around. Thank you.
The first 6 months of my nursing, I worked in emergency. It was a very rude awakening. This was not what I anticipated when I did my studies. It's not the first time I've seen it. It's not going to be the last time I see it.
Because he's dangerous awake, he stays sedated until they're sure he's out of the grip of ice.
Where did the trauma that was here go? Resource 4, okay.
With the pressure not letting up in the Royal Melbourne ED, Senior Emergency Doctor Emma West takes charge of a rush of trauma patients.
Royal Melbourne, Emma speaking. My job is multitasking. It's a little bit reminiscent of me at the kitchen bench with the kids, just putting out spot fires here and there. I'm turning off the wrong computer on IT challenge. I can't make the phone work and I can't make the computer work. It'll get better. It can only get better. So now we've got 3 relatively sick traumas coming in at the same time. Royal Melbourne receiving.
With 3 new traumas, another call comes through from Air Ambulance, flying from country Victoria with a woman who's been critically injured in a high-speed crash.
We've received a phone call of a patient that's only a short time away, a 35-year-old woman who's been involved in a high-speed car accident. We're extremely worried about her. Her numbers are way off, so she's got a very fast heart rate and a low blood pressure. The paramedics suspect she's bleeding internally. She's very, very sick.
With resources stretched by the heavy caseload, Dr. Emma will be joining the team to care for the critically ill woman.
Hi.
Hello.
Chopper's landing on the roof.
Having just left her last patient, Dr. Maya Kubert is also called in to help.
I'll check the other obs. They're abnormal.
So a call.
Trauma call.
Okay.
Maya and Emma have worked together for more than 5 years. Both are mums of young children with partners who are doctors.
Maya and I work very well together. The way she thinks about problems and approaches problems is very similar to how I do.
The team has just found out the woman is deteriorating rapidly. Her blood pressure is plummeting. It's a red flag to doctors. She's bleeding internally.
Yeah. Maya, blood pressure 70.
Oh, that's probably good to know.
She is so sick that she could continue to bleed and die before she gets here.
Air Ambulance touches down without a minute to spare. Emma, a mother of 1, is clinging to life. She had just dropped her 5-year-old daughter to school when her small car was T-boned at 100 kilometres an hour.
Oh, let's get wrapped up. Oh, she didn't shake and pump.
In a multi-trauma, as Emma is, someone who has a heart rate as high as she does and a blood pressure of 70, that's critically unwell. That's a bleeding patient, and that's someone whose life hangs in the balance, essentially.
Over in Resus Bay 3, electrician Sean has suffered a shocking foot injury after falling 4.5 metres off a ladder while trimming a tree.
My ankle's killing.
The shin bone is pushed through the skin, and Dr. Luke De La Rue believes Sean could lose his foot if it becomes infected.
Really sore.
It's an open fracture dislocation. Do you want to get some ketamine?
An open fracture dislocation is when there's a dislocation of the joint itself, so the bones move out of alignment, and there's an associated fracture around that area.
Outside, Dr. Luke is coordinating several trauma cases at once, but he needs more hands.
I haven't seen 9 yet, but I'll catch up in a second. The sutures, it's an open fracture dislocation, but he's screaming the house down, like threatening almost to punch the nursing staff just because of his discomfort. So, yeah, perfect. So I'll crack on and see 9, yeah. Yeah, thanks.
Emergency's most experienced doctor, Jonathan Papson, takes charge.
Sush, you need some help? Yes, you need some help. Okay.
Dr. Jonathan's job is to prepare Sean's leg for surgery.
The bone's exposed to air and all the other stuff that's landed on his leg as he's fallen down the tree, it'll get infected for sure. It's something that needs to be washed and cleaned within hours to minimise the chances of a significant problem. So what we were going to do, sedate him. Do you want to pull the ankle? Yep. Yeah.
With the help of an orthopaedic specialist, the team prepares to put Sean's dislocated, broken ankle back in place.
Everything we're doing is to try and give him the best chance of that leg working properly again for the rest of his life.
Dr. Jonathan is a 25-year veteran of the ED and has treated hundreds of patients with fractured limbs.
I like the pace and I like going from one thing to the next to the next. Probably the most fun of emergency, the most enjoyable bit is working with your colleagues to get things done. What do you reckon, Anthea? Is he going to cooperate?
I think I need a lot more sedation.
We have a nice camaraderie in the emergency department, which makes it special. No. Just give us a chance to do what we need to do, all right? We're going to give you some oxygen.
Now, for the first time, the team is ready to remove the bandages and see the extent of the injury.
Here we go.
Sorry.
It's nasty. Kind of expect that when you fall 4 metres, but it's a bad one and it needs a bit of work to put it back in place. Now, we're going to give you some medicine called ketamine, and sometimes with that medicine you'll hallucinate and see flashing lights. That's all pretty normal, all right? So just go with it. Yeah, that's the way. And just go with it. Go with that weird feeling. That's fine. Just relax.
The orthopaedic team will wait for Jonathan to give the OK to start working on Sean's ankle.
When we think the patient's ready, and then when I think I'm ready, I'll tell them to go. In the K-hole, Sush? We call it the K-hole. You want him in the K-hole, that's when he's had enough ketamine. When he's in that state, we're good. All right, just see how you go. And with a short-acting drug like ketamine, sometimes it just starts to wear off a little bit, or you're not quite there. All right, just see how you go.
So I'm looking at stats of 82 and a heart rate of 140.
On an emergency dash from country Victoria to the Royal Melbourne, critically ill mum Emma is fighting for life after barely surviving a car crash.
So just need you to stay a bit quiet.
Emergency Dr. Maya Kubert is in charge of the trauma response.
It's logistically terrible to do this stuff with PPE on. I apologise.
The mask prevents your voice being heard, and the shield is reflective of the sound waves. So when somebody's talking to me, not only are they not able to get their voice out, but when it gets to me, it's often reflected off my mask. So we all feel like we're constantly shouting at each other.
Please don't take offence at that. I'm just trying to make sure that you can hear what I'm saying.
Emma's car was T-boned at 100 kilometres an hour on a country road. Assisting Dr. Meyer is Senior Emergency Doctor Emma West.
A 100-kilometre-an-hour car accident is horrendous. The forces that travel through someone's body when they suddenly stop are huge. So it travels through every organ. It travels through the brain, the pelvis, the heart. And so our job as detectives is to find out where it is that that patient is injured and what it is that we need to do to save their life.
Patient Emma's blood pressure is dangerously low.
And when it gets down to 70, we start to worry that we're in a state we would call shock. In other words, the blood pressure is no longer supplying the amount of blood to Emma's body that she needs to keep her vital functions going. For example, your brain or your heart or your kidneys. My main concern is she still bleeding? Because then that blood pressure is going to keep going down.
Oh, that's all in the belly?
The low blood pressure is telling doctors she's bleeding internally. It's a matter of finding where and finding it quickly.
Fast ultrasound.
Fast.
Emergency Doctor Scott Taylor will try to find where Emma is bleeding using ultrasound.
Can you just bring this arm out a bit for me?
And Scott, how are you going?
Yeah, so it looks like a right-sided hemothorax. A hemothorax is a pooling of blood around the lung itself. It can be caused by injury to the blood vessels of the chest wall or to the blood vessels surrounding the lungs themselves. You can lose a lot of blood into that space and that can cause life-threatening bleeding.
Okay, so I'm just going to say that blood pressure is unreliable. We'll ignore that.
on the other arm.
The doctors suspect Emma's also bleeding somewhere else.
Get some access. What I'd like to do first is see if we can get her blood pressure up with a bit of blood.
So whenever anybody comes in looking like Emma, we're always worried that whatever bleeding has occurred to put her in this state is ongoing and she's at risk of dying.
I know, I'm so sorry.
To push Emma's blood pressure up, Dr. Scott has to get an intravenous line in her arm to pump blood faster into her body.
The aim is to get the biggest line we can in the biggest vessel that we can so that we can put blood and other blood products and other medications through as quick as possible.
You reckon you're in?
Nah.
Dr. Scott keeps trying, but because Emma's blood pressure is so low, the vessels are hard to reach.
And that often requires the use of an ultrasound device, which is difficult to use in a trauma setting where there's people everywhere and space is at a premium.
I'm Emma, by the way, but I'll find out your name, but you just relax. What's your name?
Emma.
There's Emma's everywhere today.
I'm Emma. Using a small cannula that the paramedics have achieved is all we have in terms of being able to give pain relief and some resuscitation, but it's not enough to keep her alive. So we need big, wide bore access to be able to flow that blood in to bring up her blood pressure.
Sorry, Em. Sharp scratch here. Bit of pushing.
Emma's terrifying near-death accident happened only minutes after she dropped her 5-year-old daughter Ashley to school.
This is barefaced humanity right in front of you. She's a mum, she's dropped her child off at kinder for the day, and now she's here lying on a cold trauma room bed, looking at foreign faces, trying to help keep her alive. It must be so scary.
Emma's husband, Adam, is 3 hours away from the Royal Melbourne. He was at the crash scene in minutes because of an inbuilt alert feature on Emma's smartwatch. Dr. Scott finally sets up the line to transfuse blood and push the young mother's blood pressure out of the danger zone.
Keep those eyes open for me. I know it's cool. We're going to get you off to sleep.
Hi, Sharon, Emma, we're speaking. In about 10 minutes, we've got a trauma in Trauma 2 that'll come to scan her. Are you going to be free? We've given her blood and now she's stable. This could be a very short period of time. She could certainly become unstable at any minute. So rushing to the CT scan is really what we're trying to do right now, because she is in a state of live or die that is changing every second.
And we'll just make sure she remains steady over the next 5 minutes. If that's okay, we're going to go to CT.
Hey, how you doing?
It's an unrelenting day in the ED for emergency doctor Luke Delarue, who is expecting yet another trauma.
We've got a trauma coming in. Have they updated recently or not?
Dr. Luke is a country boy, and he couldn't think of a better foundation for surviving the pressures of emergency medicine.
Yeah. Cheers.
So I grew up in a small country town called Colac. I think growing up in the country, people assume that you're a little bit more laid back, and I think you have to be that in emergency medicine.
Luke's next patient has been airlifted from his farm 200 kilometres away because of the severity of his injuries.
So we've got a 55-year-old gentleman coming in who's had a collapse. He's laying on his face. His eyes are actually almost completely closed. And it sounds like he may have had some kind of cardiac event which has resulted in his collapse.
55-year-old Mark from country Victoria has suffered terrible facial injuries in the fall.
Very stable. Beautiful. No airway concerns? No.
His face was pretty swollen. He was pretty beat up. He'd certainly looked like he'd been whacked pretty hard and fallen quite hard, yeah.
G'day, mate. I'm Luke. I'm one of the emergency doctors. Yeah. I know it's a bit hard to see at the moment. We're going to get you up and get you across onto our stretcher, all right? Yeah. So you stay still, we'll do all the work. All right.
Mark is retired and lives alone after the recent death of his father. He's suffering some amnesia from the whack.
I'll not be at fault.
Yeah.
I just can't remember
Yeah.
much after that.
Okay.
Even though he has no memory of the fall, it was Mark who rang paramedics. And from their calculations, he was lying face down on the floor for 3 hours.
This morning he describes that he got up at 5 o'clock in the morning and went for a bit of a felt like he needed to go to the toilet. The next thing he knows, it was 8:30 in the morning and he's lying face down in a pool of blood. Okay.
He's got a lot of bruising and swelling around the eyes just from hitting the floor. And then due to the gravity and due to being face down for such a long period of time, that tissue becomes more swollen. So it's like if you sit down in the chair for a long period of time, you'll notice more swelling of your feet.
Right, I'm going to try and have a look at those eyes, okay?
Mark's injuries suggest he might have blacked out and fallen heavily, possibly from an underlying medical issue.
In Mark's case, the paramedics were fortunate enough to have captured a period of very rapid heart rate on the ECG monitor, and it looked as if he was in an arrhythmia, so his heart was going at about 150 beats per minute. The normal heart rate in someone Mark's age would be between 60 and 80. The concern in that case is, has he had a primary cardiac event, which has caused him to lose consciousness and subsequently fall?
There may also be another reason for the swelling in his eyes, and it's not good.
If Mark's got build-up of pressure and bleeding behind the eye, he would have irreversible loss of sight in his left eye.
In the Royal Melbourne Emergency Department, Senior Dr. Jonathan Papson and his team are trying to put Sean's dislocated, broken ankle back into place.
We'll sort it out for you.
But the self-employed electrician is still in pain, even though he's heavily sedated.
Give him a bit more. Yeah. That's the way. We're almost there. The problem, of course, with the medicine is sometimes he needs a bit more. It's a little bit of a juggling act to get that dose quite right. Should be all right. No, I think we'll be all right. Yeah.
Certain Sean is now unconscious, Dr. Jonathan and his team prepare to literally pull on his leg to get the bones to click back in.
All right.
All right, I got the leg. I want you to provide counter traction.
So, the body just wants to go back to the way it's supposed to be. All we're doing is helping it back into place. So we kind of pull like that, and it'll click back in place. All right?
All good.
Looks like he's catatonic.
Yeah.
Yeah. That's the way we like it. Yeah.
Once the bones are realigned, they're kept stable by wrapping them in plaster until Sean goes to surgery.
It's all right, just give you a bit more of the special medicine.
But there's a problem with the plaster cast.
Hand? Yeah, hang on, you lost that. Yeah. Unfortunately, just at the moment when we had the thing in place, Sean moved, possibly because the anaesthetic was a little bit light at that point. So the plaster wasn't quite set, didn't hold, so we had to do it again. Yeah.
Does it come back out again?
Yeah, it's come out. We'll fix it.
It's a setback for the team. Infection is still a real risk, and the electrician needs surgery to save his foot.
Enough? You're probably ready for x-rays, yeah? Yeah.
An X-ray will show if the cast is holding Sean's ankle in position, ready for the surgeons.
We want to see that those bone ends have come like that on the X-ray, or at least as close as possible to that.
Pelvis good?
Pelvis good. Okay, he's good. He's good to go. My advice would be get one of those extender pole chainsaw things. Got one for my birthday. So I got an extender cutter for my chainsaw so I could lop the branches instead of going up the ladder. It's great. It works better than the chainsaw. Don't need the ladder. Highly recommend it.
Sean still has a big operation ahead. With no certainty he'll regain full use of his ankle.
Any injury to a leg could be life-changing. If his job requires him to be, very flexible on an ankle, he might run into trouble later on. Whenever you have a nasty fracture, you might end up with just a subtle difference in the way things work.
And what year is it? 2009.
Down the corridor in Resus Bay 1, 55-year-old retiree Mark is shaken up and confused after falling face first in the early hours of the morning on his way to the bathroom.
There's some cold jelly on your tummy, okay?
Mark lives alone in country Victoria with his 2 dogs. He lay unconscious for 3 hours, bleeding heavily from his badly bruised and swollen face.
Any pain there? Is that all right?
Fast one.
What do you do for work, mate? Are you working at the moment?
No.
No?
Stopped work. When Dad got through, he's still alive in 4 years. He just passed away recently.
Oh, I'm sorry to hear that.
Yeah.
How long ago was that? This year?
3 weeks ago.
Okay. Is anyone at home with you at the moment?
No.
Okay.
He's managing remarkably well. I think part of that is he's just a tough guy, he's a stoic guy, but equally he's also banged his head pretty hard. If he's going home by himself, then obviously he's going to require more support than someone who might be at home with a loved one.
Emergency Dr. Luke De La Rue's major concern is what's going on behind those swollen eyes.
Have you been able to see out of your eyes since the accident?
Not a lot.
Not a lot?
He's worried Mark could have suffered permanent eye damage and not just localised swelling.
We worry about the build-up of pressure behind the eye, usually from bleeding. That bleeding can put pressure on the optic nerve, and if that's not relieved within 30 to 60 minutes, that pressure will irreversibly damage the eye. Unfortunately, because of the prolonged time it's taken for him to transfer to us, we're likely well outside of that window, and he could have lost sight in his left eye already.
We're going to get you through the CT scanner in a minute and have a look and see what you've done to yourself, okay? All right. We'll take good care of you.
And we'll just make sure she remains steady over the next 5 minutes. If that's okay, we're going to go to CT.
I'll check the next one and bring it to you. She's going to need that blood. Yep.
At the Royal Melbourne Hospital, mother of 1 Emma is battling to stay alive after she was critically injured in a 100-kilometre-an-hour car crash minutes after dropping her 5-year-old daughter to school.
1, 2, 3.
Dr. Maya Kubert and the emergency team stabilised Emma after a potentially fatal dive in her blood pressure. And they're now hoping the CT scanner can pinpoint the internal bleeding.
And we need more understanding of what her injuries are in order to know what the definitive care for those injuries might be, including does she need an operation to stop the bleeding.
lateral side wall on the right, and she's got herniation through it.
Hello, can you hear me?
Herniation of, sorry?
So herniation through the right lateral abdominal wall.
Yeah, which is why she's so bruised.
Yeah.
As Dr. Meyer suspected, the abdominal pain Emma was complaining about is the source of bleeding. And it's a devastating injury.
What we discovered in the CT scan is that Emma has a really significant injury to her abdominal wall, in that her abdominal wall, despite being intact on the skin, underneath has all come apart and her bowel is coming through that abdominal wall towards the surface. It is a horrific injury.
Oh, hi Adam. My name is Maya. I'm one of the emergency doctors at the Royal Melbourne. I'm just ringing to see if anybody has given you an update yet.
As Emma is prepared for urgent surgery, Dr. Meyer calls her husband, Adam, who's caring for their 5-year-old daughter, Ashley, at home.
Those are the major issues at the moment, and we'll know more after she's had the operation. Okay, bye.
Once I'd had that phone call, certainly within myself, there was a lot more worry. I probably tried to make sure that I shielded Ashley from that. I didn't need her having the worry while we didn't have all the information, so I tried to keep a positive face.
All right, let's go. Let's go.
What we have to do, and what we call a traumatic laparotomy, it's so that the trauma surgeon can rapidly establish where the bleeding is coming from, which organs are damaged, and to provide some kind of early damage control to stop that bleeding. So I imagine that for Emma, this will be potentially more than one surgery and a really long period of recovery. I think relating to somebody's situation is easier if you can put yourself in their shoes. I've got young kids. So yeah, I can relate and I can absolutely see it as being horrific. If she hadn't had the care that she'd got, she would have died.
Theo, look what Daddy got you today.
Dr. Meyer, who has 3 young children, recently went through her own health crisis when she contracted COVID, probably from a patient.
I looked after a guy who got COVID, and then about 3 days later, I became unwell. I think it was probably that, but I still don't really know.
She went into hotel isolation to protect her young family. Her husband, Bjorn Macon, also an emergency doctor at the Royal Melbourne, cared for 9-year-old Lily and 5-year-old twins Sebastian and Theo.
Oh yeah, you are definitely getting taller than Theo. Look, the kids, I think, were relatively traumatised. They were confused by the fact that they couldn't give Mummy a hug. They all slept in the one room with me and
Did they?
Yeah.
I didn't know that.
We'd camped out and that's where they learnt their joy of jumping on beds.
Where did you get all of them from?
Most of them from Granny.
Maya wrote an article about her illness, which inspired other frontline workers who've had COVID.
I am a nurse and I was also diagnosed with COVID, much to my shock. I was being so careful. And yes, I have found that people do think you must not have been using PPE properly. I do hope that you have recovered. Thank you for your integrity. Take care always. It was a really lovely card. So I wanted to say thank you to whoever it was that sent this to me, because it really meant a lot for me to receive that, because I know what it felt like. Even if it was just one person, I was glad that they felt grateful to be able to read what I wrote, even if they didn't give me their name.
Have you had a CT scan before? Mark, very still, okay? Please don't move, okay?
Back at the Royal Melbourne's emergency department, 55-year-old retiree Mark is getting a full CT scan after falling face first at home and knocking himself out. Emergency doctor Luke Delarue is worried Mark has damaged his vision, and the bruising on his face suggests other internal injuries.
My main concern is, does he have bleeding on the brain or an associated skull fracture?
He's clearly got a nasal bone fracture there, which is not surprising because clinically he's got a broken nose.
But the scans reveal other, more serious injuries to Mark's head and brain.
The white stuff here is the skull. The black is air, and so you've got black here in the sinuses, which is normal. This grey area where the air should be is actually blood in the sinus.
The results of the CT scan show that Mark has extensive facial bone fractures. He's got multiple skull fractures, and it confirms that he does have bruising and bleeding on the brain.
All right, so Mark, you've done a good job of things.
Adding to Mark's injury toll are a couple of broken ribs and a small fracture of the spine.
So there's the ribs, there's the back, and then there's the face and the brain, okay? They're the things we're most worried about.
He's remarkably comfortable and stable for someone who's got that degree of injury.
Despite all of that, you don't have anything that immediately needs to be intervened on. You're maintaining your airway, your blood pressure's fine.
Yep.
You're going to have a bit of pain, you may feel nauseous, and we just need to keep a close eye on you, essentially.
Yeah, good to know.
Okay?
Yeah.
When Mark arrived in emergency, he couldn't see, and Dr. Luke feared the swelling behind his eyes could cause blindness.
Can you open your left eye now? It looks better.
Yep.
How many fingers?
2.
Now? Now?
2.
Beautiful. All right, good.
There's nothing to suggest any build-up of blood or pressure behind the eye itself. So hopefully once we're able to reassess the eye, there shouldn't be anything that suggests permanent visual loss.
Mark has a long and painful recovery ahead, but he's incredibly stoic, and that doesn't surprise Luke.
It's classically people who come in from the country, but typically farmers that come in and just break all the rules in terms of, what's the standard response to pain.
The next day, the swelling in Mark's eyes had gone down and he was able to see.
So I just woke up and there was a pool of blood, and I thought, I'm in trouble here.
He stayed in hospital for a week, recovering from his other injuries. The cause of the fall remained a mystery until now.
And I've got dogs. Sometimes they come inside and they'll just lay down, and then you've got to walk around them. So whether I've tripped over one of them, I'm not trying to blame my dogs, of course, because I love them.
Please! My ankle, please!
51-year-old Sean smashed his ankle when he fell 4.5 metres while trimming a tree.
There we go.
So as soon as I hit the ground, I saw the foot go that way and the leg that way.
A day later, Sean is in remarkable spirits. Feeling lucky, doctors were able to mend his broken, dislocated shin bone.
I thought I was in a lot of trouble. I was scared they were going to cut the foot off.
The self-employed electrician has months of rehabilitation ahead of him. The young man in a dangerous, drug-fuelled rage was sedated and kept overnight for observation.
Airway, restrained, nicely asleep. Let's leave well enough alone.
He was discharged the next day.
That's all in your belly?
Mum of one, Emma, was clinging to life with horrific internal injuries from a high-speed car crash, as emergency doctors battled to stabilise her for urgent surgery.
So it looks like a right-sided hemothorax.
It's been a long, hard road with many operations.
It was touch and go when they didn't think I was going to make it through several of the operations. And I was starting to get to the point where I was just like, not again. I want to just go home.
Incredibly difficult to see him struggling and seeing her dealing with all the bits and pieces, and it's been very hard.
The support of her husband Adam and 5-year-old daughter Ashley has helped Emma pull through.
Adam and my family and their support, it's made me very grateful.
Doctors hope Emma will be able to go home soon.
Yay!
I guess for me a big thing is you've got to really be thankful and be present in the moment rather than worrying about what's happening 5-10 years in the future.